Hello future RMTs. In this video, what we're going to discuss is all about cestodes. Our learning outcomes are number one, recall the morphology, life cycle, pathogenesis, epidemiology of different cestodes, and to distinguish the diagnostic features of different cestodes. To start, these are our parasites now that belongs to the cestodes. We have your Taenia saginata, also known as the beef tapeworm, the Taenia solium, also known as the pork tapeworm, Taenia asiatica, also known as the Taiwan Taenia, or commonly referred as the third Taenia species. We also have your Hymenolapis diminuta, also known as the rat tapeworm. We also have your Hymenolapis nana, also known as the dwarf tapeworm. We have your Dipylidium caninum, also known as the dog or cat tapeworm. We also have your Diphyllobothrium laton, also known as the broadfish tapeworm. Next in line is Echinococcus granulosus, known to be your dog or hydatid tapeworm. You also have your Spirometra, and of course your Retina garrusii. It is important for us again to discuss or to start this discussion to define basic definition or basic terms. Number one is cestodes. I want you to take note, people of God, that cestodes is also a helminthic parasite, a multicellular parasite. However, cestodes is different from nematodes in a way that cestodes are flat. Cestodes are segmented, and cestodes are equipped with what we call uh, suckers. Although some of the nematodes also equipped with suckers, but it is prominent into cestodes or cestoda or class cestoda. Again, nematodes, no? Nematodes, if you still remember our discussion in nematodes, we said that nematodes are roundworms. Alright? Filaria is an example. Filaria is also considered as nematodes. However, filaria is flat. No? Almost the same thing with our cestodes. Remember, cestodes is referred as the flatworms or the tapeworms because of its characteristics of being a flat. All right. Again, when we said gravid, that is, it means pregnant. Now, one of the other factors or classification that will differentiate our cestode from nematode is that they are hermaphroditic, which means they are capable of self-reproduction, self-fertilizing. It means that no, the both male and female sex organ are present in a adult tapeworm. Unlike nematodes, wherein there are female nematodes and male nematode, a female ascaris and a male ascaris. In cestodes, they have a poor sex life. Okay, hermaphroditic sila eh. Self-fertilization. Okay? Next in line is we have here your, what do we mean, hexagon embryo. When we said hexagon embryo, these are motile first larval stage, characterized by the presence of 6 hooklets or hook. It is one of the most common denominator of all eggs, no, of the cestodes. The presence of hexagon embryo, most especially in Taenia, okay? And also the presence of the radial striations for Taenia. When we said proglottids, these are the segment. Like what I've said a while ago, no? Yung ating cestodes segmented. And each segment, no, of the cestode's body is what we call proglottids. Okay? Proglottids is the segment of the body of a cestode. Okay, that contains the male and the female reproductive organ. Well, of course, for reproduction. Next in line is they also have what we call the rostulum. These are a fleshly extension of selected tapeworm scoliosis. When we said scoliosis, these are what we call the head. Okay, the scolex is the singular form. No? Anterior end of the tapeworm that typically possesses the top, and that is what we call the suckers. There are three prominent body or parts of a cestode: the scolex, the neck, and the proglottids. Okay? Yan lang. Ito yung parts of the body of a cestode. The scolex is the head. Proglottids is the segment. Okay? Proglottid is the segment. Again, they are segmented. No? And each segment, no, of the cestodes is housing or containing one male sex organ and one male sex organ. Okay? Now, for the morphology of our cestodes, it is also evident that cestodes, the same thing with our nematodes, has three lives morphological forms: the egg, the adult, and the larvae. Okay, so when we said adults is the one that possess the anterior head, which is known to be the scolex. No? There are numerous of segments, no, sa adults. Egg naman, meron siyang mga uh, hexagon embryo, okay? And the larvae is considered as the infective stage. By the way, before I forgot, no, balikan ko lang yung sinabi ko kanina tungkol dito. We have the scolex, we have the neck, and our proglottids. We also have what we call the strobila. Okay? Strobila is the body. Now, proglottids is the segment. And when we said the strobila, that's the body. No, yung katawan ng cestodes. All right, ingestion of single tapeworm egg allows the continuity of the life cycle. It's either you consume the egg of the parasite or no, you were exposed into its larval stage. Now, if you still remember our discussion in nematodes, we said there that nematodes are typically facultative parasites, which means they are free living. The presence and the absence of the host, no, is or the presence of the host will allow them to continue their life cycle. It is a benefit for them if they have the host, but they can also survive even without the host because that is their nature, that is their characteristics, unlike in cestodes. Because cestodes requires at least one intermediate host. As we all know, intermediate host is the one that hatch or uh, that matures, no, the larval stage of the parasite. All, take note of this, all cestodes requires one intermediate host except for Diphyllobothrium latum. Diphyllobothrium latum. Okay? Please take note of this. All cestodes requires one intermediate host except for Diphyllobothrium latum, which, no, requires two intermediate hosts. The first intermediate host of Diphyllobothrium latum are copods, or is copods, and the second intermediate host of Diphyllobothrium latum, from the word itself or from the common name itself, freshwater fish tapeworm, is the freshwater fish. Okay? Moving forward to the laboratory diagnosis, this is also the same thing with our nematodes, wherein we're going to recover the egg, the proglottids, and the scolex. Now, if we recover egg, it means that there is the presence of the parasite. It can be the Tania, it can be the Diphyllobothrium, It can be the Diphylidium caninum or the Hymnolapis nana. Okay? And like cestodes, or like nematodes, our cestodes has its own distinguishing characteristics. No? Meron siyang radial stations, that is, your taenia. Meron siyang operculum, or meron siyang operculum, that is your Diphyllobothrium latum. Meron siyang hooklets, and so on and so forth. Okay? Those are the things that is common, or that is unique, no, to our cestodes, and that will help us to identify the presence of the parasite. The proglottids can also be seen in a clinical sample. If you still remember, no, in our previous discussions, I've said a lot of times, or meant a couple of times, that cellophane tape swab, para maleta spelling ko, cellophane. Okay, wait, I'll just double check. Cellophane, tama naman pala. Okay, the cellophane tape swab is considered a diagnostic test for Enterobius vermicularis, right? Vermicularis. Okay, that is collected early morning. Okay, but I want you to take note, people of God, that cellophane tape swab can also be useful for the demonstration of the proglottids of our taenia. Okay, it can also be used to demonstrate, okay, the presence of the proglottids of taenia. Next, it is inappropriate to say Scotch tape. Okay, although some of the references or even some of the review materials said Scotch tape swab, but it is inappropriate. Why? Because Scotch tape is a brand of a cellophane tape. Okay, of a cellophane tape. So it is better, just right, and necessary to use cellophane tape swab. Or we can also use perineal swab. Okay, next, in order for us to really achieve a success treatment for cestodes, we have to demonstrate the scolex of the parasite. Recovery of the scolex of the parasite means successful treatment with cestode infection. Why? Because if you just recover the egg, if you just recover the proglottids, once that there is still the head or the scolex of this parasite attached in the intestinal mucosa of our GI, it is still capable of producing proglottids, that is capable of producing eggs, that is capable of producing hundreds of parasites. Thus, it is always said that successful treatment of cestode infection should reveal the scolex. Again, scolex is the head of the parasite. Usually, the sample of choice for our cestode demonstration is, of course, stool. But there are other parasites wherein stool is not recommended, or we can use stool but not that specific. Let's say, for example, in cases of Echinococcus granulosus. Echinococcus granulosus is an example of extraintestinal tapeworm. Thus, it means it resides outside the body, or outside of the intestine, liver, brain, something like that. Which means the sample of choice for our Echinococcus granulosus is biopsy of tissue. Another thing is Peñasolium. Peñasolium is the pork tapeworm, no? The pork tapeworm. Tama, no? That's the pork tapeworm, and we can use stool as the sample of choice. But did you know, guys, that it is also capable of invading our central nervous system, including the brain. Thus, a biopsy or tissue samples is also good for the demonstration of our Taenia solium. However, I want to make it clear that all cases of Taeniasis associated to Taenia solium will reveal the presence of the parasite in the brain. Eh kung hindi naman nag-invade ng brain, why do we have to? Okay? That's why the sample of choice for Taenia is still stool. Because it is evident and it is common that Taenia saginata or Taenia rather is an example of an intestinal parasite. Thus, therefore, it is just right and appropriate to say that stool is the sample of choice. As per pathogenesis and clinical symptoms, well, of course, since these are all, these are majority of these are intestinal parasites. Thus, therefore, it is not common that a patient will experience gastrointestinal discomfort, including diarrhea and abdominal pain. As we said, abdominal pain, diarrhea, and abdominal cramping are one of the most common symptoms associated to a patient with parasitic infection. Dizziness can also be possible, headache, weight loss, and obstruction, intestinal obstruction. Why? It's capable of intestinal obstruction. No? Kung tinatawanan mo ako, pero sige ka, tumawa ka, kung tinawanan mo ako, hindi ka papasa. Okay? It is capable of intestinal obstruction. Why? If we are going to recall the body or the appearance of cestodes, we said that they are flat. So they are capable of holding itself in the intestine. Thus, therefore, kapag naman sobrang laki na ng fold, no, it can cause obstruction. No, I skip this one. Asymptomatic, yes, that's true. At first, they are asymptomatic. It is not necessarily mean that if you consume a contaminated pork with Cysticercosis celucei, you will develop immediately Taenia saginata, Taenia solium. So it doesn't mean like that. Okay, that's why you might be asymptomatic for quite some time. Then, after the incubation period and the development of the parasite into its adult form, you'll experience symptoms associated with the parasite. Another thing is some of our cestodes are capable of causing anemia. No? Let's say, for example, Diphyllobothrium latum is capable of causing vitamin B12 deficiency anemia, also known as pernicious anemia, or classified as megaloblastic anemia. Okay? Si hookworm microcytic hypochromic anemia, though to forget, si Diphyllobothrium latum is megaloblastic anemia, or sometimes referred as the vitamin B12 deficiency anemia. Now, I said a while ago that Echinococcus granulosus is an example of a parasite that is considered as an extraintestinal parasite. Thus, therefore, patients may experience liver and lung involvement, persistent cough because of the lung involvement, localized pain, eosinophilia, and anaphylactic shock as a result of allergic reaction to the antigens of our Echinococcus granulosus. Cestodes are classified into two. No? They are classified into two. We have your pseudophilidians and we have your cyclophilidians. Now, if we are going to differentiate cestodes based on this, they are different in terms of the sphonex, in terms of the strobila, in terms of the ova, in terms of the larval stage, and in terms of its intermediate host. If you still remember, I said a while ago that all cestodes requires one intermediate host except for Diphyllobothrium latum, which requires two intermediate hosts. One is crustaceans, that is your copods, and the other one is a fresh water fish. That is true to our Diphyllobothrium plateau. Now, in case of scolex, which is considered as the head, yung scolex ng pseudophilidian is spoon-shaped. Okay, alam niyo naman siguro ang itsura ng spoon. Okay, gumagamit kayo yan 24 hours every day, 3 times a day or more than 3 times a day. That's the spoon. Now, if I'm going to draw, it is something like this. No? Yan. Medyo papaganan. The head, the scolex. Now, unlike your cyclophilidian, quadrate with 4 suckers, with the presence of rostulum, no? With or without hooklets. Yung pseudophilidian natin, spoon-shaped, with slit-like structure. May slit, may parang butas, may parang hiwa. Okay? Yan. This is nice. No? This is the head of our Diphyllobothrium lato. And there is a slit-like structure with no scolex. I'm sorry, with no hooklets. Thus, therefore, no rostulum. Rostulum resembles a crown-like structure. If you still remember my first slide, they have there the head, the scolex of the parasite, and there's a crown-like structure that represents the rostulum. Rostulum may have hooklets or may not have hooklets. In terms of strobila, no, nut shedding segment is the strobila of the pseudophilidians, while for cyclophilidians, apolyctic, no, shedding segments. Kitang-kita mo yung segments ng mga ng mga cyclophilidians. Ova, no, ova is oval and operculated, usually immature. Operculated is the lid-like structure. Okay? Lid-like structure. Let's say, for example, this is the egg. Let me draw it on the best capability that I can. Okay. This one, no, I'm sorry for my poor drawing. This one is the uh, operculum. Okay, operculum is the lid-like structure. Operculated ang tawag sa'yo if you have an operculum. Okay? So usually the pseudophilidians, sila ay operculated. Now, moving forward to our cyclophilidians, spherical and non-operculated and usually embryonated. In terms of the larval stage, both of them has three or have three larval stages. For pseudophilidians, we have the coracidium, to be followed by procercoid, and the final larval stage is the plerocercoid, which then eventually will transform into its adult form. For pseudophilidia or for cyclophilidians rather, we have there your cysticercoid, cysticercus, and hydrotin. Cysticercus is like for example in cases of Taenia saginata, no? The cysticercus bovine, no, is the infective stage of our Taenia saginata. All right. So again, here are your pseudophilidians. You have your Diphyllobothrium latum, which requires human as the intermediate host. You have your Spirometra, again human as the definitive. Diphyllobothrium latum definitive host is human. Spirometra, humans are intermediate host, which means humans hatch, no, or uh, allows the development of the larval stage of Spirometra. Further, cyclophilidian includes your Taenia saginata and Taenia solium, which requires vertebrate intermediate host. Solium, the the dog or the dog, I'm sorry, the pig, no, is the intermediate host, where swine is the intermediate host. For Saginata, we have the cow or cattle as the intermediate host. Okay? For caninum, Diphylidium caninum, no, invertebrate, intermediate host. These are considered as your the dog or cat tapeworm, but take note guys, no, yung fleas, no, the cat fleas and the dog fleas serves as the intermediate host of Diphylidium caninum. And lastly, we have your Hemionapis nana, which may or may not require intermediate host. Later, we're going to discuss what is the intermediate host of your Hemionapis nana. All right.